Good afternoon and welcome to day 368 at the EMA office here in St. Clair County, where I'm joined with Myla Blanford from the Health Department and Chairman Kern. And Chairman, we got a special guest joining us today, and I'm really excited because this lady is always on my speed dial. So why don't you introduce the general to us?
Well, and we're really honored today. You know, we talk about Team St. Clair every day, but really it's that help from above that makes Team St. Clair able to do what it does. And so today we're joined by the director of IEMA, the Illinois Emergency Management Agency, Director Tate Nadeau, General Tate Nadeau, who's here to talk to us today. We were lucky enough to get a visit from last Wednesday at our mass vaccination site from a director that is really an active part of this this pandemic relief situation that we're working on. So Director, welcome today to our briefing.
Well, thank you, Chairman. It has been a privilege, and you know, it's funny. I think you started this off correctly whenever you talked about Team St. Clair. I've had an opportunity to go to a lot of different mass vaccination sites throughout the state, and very frankly, it was very evident that St. Clair approaches this from a whole of government approach. You truly are a team, and it really is benefiting the people in the St. Clair County, because whenever I walked through and I looked at your drive-through and your fixed site mass vaccination, I have to say that you have what I refer to as best in practice or best practices of some of the things that I've seen throughout the entire state. And I just want to give kudos to you and your folks for what they're doing. It's really a privilege whenever you see government working at its best to meet the needs of the people. And, you know, I'll give you some simple examples if you don't mind me just taking
Sure.
just a second of your time.
Please do.
But the work that you're doing with Team St. Clair, with the Salvation Army and St. Vincent de Paul's on vaccinating your homeless populations and arranging for those mobile vaccination vans or units that are going out to the shelters, absolutely best in practice. We know that COVID disproportionately affects some populations, and we really have to make sure that from an equity standpoint that, you know, we're trying to reach all folks in Illinois. And you all, again, was just very pleased to see the fact that you all had a coordinated effort to be able to do that for those people that wanted to go to your site, you know, giving out bus fares and vouchers and tickets so that people can make it to your site. Again, that level of good government was just, it was breathtaking for me. And they are best practices that through the Illinois Emergency Management, working with Illinois Public Health, we've put together playbooks for what we refer to as small, medium, and large size elements. And these are little nuggets that we take back and we incorporate into that. So other counties can actually learn from what you all have done, to see what you've done and how you've done it. So whenever they get a site in their location, they don't have to learn all the hard lessons. They get an opportunity to see the best practices from someone like yourselves to do that. I also have to tell you, again, going to many different places, looking at, you know, how do we ensure that every single bit of the vaccine that we have is being used? Your zero waste policy on vaccine to ensure that every single drop of that, every single, you know, shot is accounted for and is used by the end of the day was really refreshing to see. So I guess I simply wanted to come on and, you know, if you're from this area and you're watching this, I wanted to give you confidence that your leadership in your government is really working to benefit you. And I think you have a top-notch drive-through capability. So,
Well,
sir, I probably talked longer than you wanted me to.
you're good.
Uh,
You're good. And so I'm lucky that Mila and Herb are, just like any kind of a structure, having strong pillars with you makes that that building stronger. And I'm lucky that I got two of the best partners in the whole world that make me look good. They're the ones who do all the work. So that's why I'm lucky. Let's talk a little bit about the state. Maybe can you give us an overview of how the response is looking in the state of Illinois right now?
So, like everybody else, it's all about mass vaccination. We know one thing for sure. The first state, the first country that can get everybody vaccinated is the one that wins economically. It really is going to be the catalyst that allows us to get back to normal. So having centers like the one that you all have and doing the outreach that you're doing to ensure that everyone has an opportunity to get a vaccine is critical for us. And the second thing I would say is we continue to fight against the clock. And what I mean by that is as new variants come out, we really are trying to hit that herd immunity just as quickly as possible. And all of that is, the state is actually doing extremely well. If you were to compare us to other states of our size, we tend to be in the top 5 at any given time as far as the number of vaccines that we're giving. I think that's something to really be proud of. I'll tell you that the governor is always challenging us, and he's like, if you're not number 1, that's where you need to try to be. And that's really why part of my job is to go out to these locations to identify what the best practices look like so that we can replicate those quickly throughout. Part of my job is to come up with, as vaccine comes out, right now we're in that position where we only have so much vaccine. But we've been told by the federal government that more vaccine is coming, and they're now giving us a 3-week notification of how much vaccine we have, and they're telling us to be prepared by the end of the April timeframe that we will see a significant increase. So my job in the emergency management side of the house is to build the state capability so we can set up more mass vaccination locations whenever vaccine is here. So we've done a couple of different things. We have built modular capabilities using National Guard troops and contracted nursing staff that go out, and we can replicate these. And we built about 100 of these teams, and we move them from place to place. And the intent is if a county says we want help, or, maybe they don't have all the capabilities that they would like, then these roll in and they actually go in underneath your public health. And we use the terminology, we bolt them on. So however they're doing operations, we tell them we've got this capability. And then that's what really drives our mass vaccination site. We've also started doing work with the federal government. During this new administration, the federal government came out with a strategy for COVID and mass vaccination. So the state of Illinois has partnered with the federal government to stand up one of its, what they refer to as a type 1 large mass vaccination site with about 6,000 shots. And we continue to partner with our federal government to look at mobile capabilities. I personally believe that fixed sites are great, but what you all are doing with a drive-through, that's the second pillar of success whenever we talk about vaccination. And the third one is a mobile capability, because we have to be able to meet people where they are in their communities. Some people will want to go to a fixed site or to a drive-through And some will want to go to a local church or a community where there are trusted people in that community that they know, and that's where they're going to want to receive their shot. So we've tried to put together a plan that hits on all three of those.
Well, Director, today's day 368 for us. You were here on day one. You and Governor Pritzker came here and talked to us, and we had a press conference announcing the beginning of this pandemic, basically, in the county. We appreciate your leadership, and certainly anytime we've needed anything, you have always been there. Herb has your cell phone number, as does Mila, and you've just always answered the phone no matter what time of day, and that has made a huge difference for us. So we thank you. We thank Governor Pritzker for the leadership, and we got a ways to go, but at least we're starting to see a little light at the end of the tunnel.
Yes, sir.
So, Mila, anything?
No, just thank you again for all your help, and we appreciate your comments about the site. I know you did a tour, and we appreciate you being there, and you're welcome back at any time.
And Herb?
Thank you. Thank you very much.
Thank you. Herb, you got anything?
Well, Director, you know I have you on speed dial, and as the chairman said, you've always been responsive when I've called or when the county's needed something, and that means a lot to our county residents that we know that we can call on your agency to support what we're doing here locally, and I really appreciate you visiting and giving me that after action report. I will put that in my file to keep forever.
Yes, sir.
Thanks again.
Thank you.
General. Thank you.
Take care.
Thank you.
You too.
And Mila, with that, I mean, I told you we had a special guest, and anytime we can get the director of the state, IEMA, to come on, it's really great for us because I think it shows our county residents that we are doing the right thing, what's best for them. So now you get to tell us our numbers today.
Okay. Well, good afternoon. For today, Tuesday, March the 16th, we have 50 new positive tests out of a total of 985 new tests for the day. The age range of positive individuals was 10 to in their 70s. County positivity rate is at 5.1%, with the 7-day rolling average at 5.4%. Regional positivity is at 3.3%, and that was of March the 13th. There are 0 new deaths today, so that's always the silver lining, the best news of the day. Countywide, we have conducted a total of 300,729 tests, consisting of 28,829 positives and 271,900 negatives. Total number of deaths to date is 462, and our condolences go out to those families. To date, the number of individuals who've completed their 10-day isolation period is at 27,870. Statewide, we've tested 19,221,483 individuals. Total positive tests were 1,212,110,000, which is an increase of 1,997 from yesterday. Deaths to date is 20,973, and that's an increase of 19 from yesterday. Countywide, the number of COVID-related hospitalized patients is at 36. Regionally, we're at 67. Patients on ventilators within the county is 5, and regionally we're at 6. Congregate Care is reporting no new cases for those in outbreak status. For testing, of course, we have St. Clair Square Mall open Monday through Sunday from 8 to 4. And then we have IDPH testing March the 18th at the Belleville-Shield Street Station, and that is from 8 to 4 o'clock with Illinois Department of Public Health. In addition, Walgreens is holding a vaccination clinic March the 17th and 18th at McKendree College from 8 to 4:30. You do need to be registered for that event, so you may want to reach out to Walgreens to find out those details on how you do become registered. Okay. Chairman Kern for the zip code report.
Thank you, Mila. Director Tate Nadeau paid a great compliment to the county
She sure
today,
did.
to your leadership and to Herb Simmons' leadership and all of Team St. Clair. It's really, this was a great day to have the IEMA director sit down with us and talk about this, so congratulations.
Well, thank you. We're very appreciative of her being here and her comments, because she's been throughout the state and she's seen best practices. So it was good to hear her feedback. It really
Yeah,
was.
and the fact that they're taking a few of your ideas and Herb's ideas, and they're gonna put them, we heard that even Michigan came here.
Yes.
The state of Michigan came and looked at this site right here in
That's
St.
correct.
Clair County, and they're reproducing that up north, so.
We're lucky to have it here. We really are.
There we go. Well, a lot of work. Thank you. So here's the zip code report for today. 62201 up 1 to 568. 62203 up 1 to 614. 62204 is also up 1 to 390. 62207 is down 1 today to 582. 62208 up 4 to 1621. 62220 up 6 to 2066. 62221 up 6 to 2770. 62223 up 5 to 1746. 62226 up 2 to 3184. 62232 up 3 to 897. 62239 up 3 to 466. 62240 up 1 to 159. 62243 up 1 to 768. 62254 up 1 to 795. 62260 up 1 to 796. And 62269 up 4 to 3,242. The 50 new positives today in the county, 985 people tested, brings that county positivity number, daily county positivity number down to 5.1%. But the rolling average does go up today to 5.4%. Regional positivity, though, is down to 3.3%. Bond County is at 2.9% today, Clinton 5.1%, Madison 8%, Monroe 21.2% today. Randolph is at a negative 1.1%, St. Clair is at 3%, and Washington is at 0%. So the regional positivity looking better, Herb. Hospitalizations continue to concern me because they're a little higher than they were earlier last week.
Exactly, and we've said this from day one. It's a regional approach that we're doing this, and just several weeks ago, those numbers were through the roof, and now we've got them down. But now, like you said, the hospitalizations. When a patient ends up in the hospital, that's not a good thing. You can stay at home and try to take care of yourself, but if you have to end up going to the hospital, that takes a lot more care. And so we're really watching those numbers.
And the 5 people on ventilators, that's a good number of people that it is a serious enough case that they've been put on that ventilator. St. Patrick's Day is tomorrow. Encourage people, wear your masks, wash your hands, watch the social distance. It's just going to be a little bit longer, and we'll be able to get these numbers down. I think the governor's going to announce the lessening of restrictions tomorrow. At least that's what we're told. There's a conference call tomorrow afternoon that we'll all be on. And so things are loosening up, and we're getting back to normal, but we just have to hold on a little bit longer, continue to do things that may not be the most pleasant, but that are going to get us to the point where we get our economy fully open, we get back to doing what we want to do in a way that we want to do it.
Well, and when you look at 368 days from when it first started, we have come a long way, and we've went through that storm. We went through people didn't want to listen, they didn't want to wear the masks, they didn't want to watch the social distancing, and we've came through that now. The last thing we want to do is to go backwards. And if we do go backwards, and everybody who's not being a part of that solution is part of the problem. So, hopefully, as you said, the governor will make an announcement tomorrow. We're not going to, I don't believe, going to just open everything back up, because I don't know if that's the right thing to do. And I know Mila's sitting there shaking her head. So we want to take these baby steps. But again, we have come a long way. And for Team St. Clair, for those of you that have been here for 368 days with us, you know what we've been through. All of us has been through. Our National Guard staff, the medical staff, our first responders, and that list goes on. And you as Team St. Clair that follow this briefing every day has been a major, major part of that. From Brian Whitaker here, Randy Randolph in the EMA staff, Tammy that does our signing, to Cindy and Daisy. Daisy this last year has had a baby, has bought a new house. So a whole year has went by. So everybody's life has been turned upside down. Some of it's been for good, but as we said the other day, there's 462 of our county residents that aren't with us now, and we don't want any more to join that stat. So let's continue to practice those best policies. Wear the mask, wash the hands, watch your social distancing. Hopefully tomorrow we'll get some news on if the mitigations are going to be lightened up a little bit more, and then we can see that light get a little bit brighter at the end of that tunnel. We'll be back with Cindy in a few moments to translate this into our Spanish communities, and then we'll be back for day 369 tomorrow. Have a good evening.
One of the ways we can combat widespread infection is testing. It's been proven time and time again that many people who were infected with COVID-19 are asymptomatic, showing no signs of infection. They unknowingly spread the virus to those most vulnerable in our community. Working together with health departments in our region, free testing has been made available throughout the area, and we encourage all citizens and visitors to take advantage of this opportunity. To Team St. Clair and the rest of Region 4, if we work together, we can and will stop the spread of COVID-19.